So, very warm good evening to everybody. We are delighted to have such a huge audience of so many elites and stalwarts of psychiatry with us to begin a brain uh, instigating session on neuromodulation. And I'm very pleased to have Dr. B.N. Gangadhar sir with us, who will be our chief guest today, along with so many dignitaries. Uh, so the today's session primarily revolves around consensus on neuromodulation training in India. And I welcome you all to this landmark meeting, which is focused on shaping the future of neuromodulation training in India. So this today's meeting is jointly organized by IToPs, the IPS UG and PG subcommittee, and we are blessed to have Dr. Gangadhar sir and Savita Malhotra madam and TSS Rao sir and all other dignitaries to be present in the audience along with the speakers. Uh, the Today's session will focus on how we can, what is the current state of neuromodulation in various institutions, premium institutions of India, and what would be the way forward. So, without further ado, I request Professor Dr. B.N. Gangadhar sir, former NMC chairman, Padma Shri Awardee, to begin with his opening remarks. Over to you, sir.
I think I didn't hear.
Gangadhar sir, am I
Yeah,
audible?
maybe your voice was breaking, man.
Oh,
It was
sorry, sir.
not audible well. Anyway, no, man, thank you. You have asked me to speak. Thank you so much. I guess Madam Savita ji is also connected with best regards to IPS Chairman, President of the Indian Psychiatric Society, Dr. Savita Malhotra ji, incoming President, very dear friend, Dr. TSS Rao, Dr. Kishor, all the colleagues and the delegates who are connected to the program. Uh, IToP is doing a wonderful job. Preparing teachers is a unique experiment, and I'm sure previous episodes have already been very encouraging. And in this episode, you have taken up the issue related to neuromodulation techniques. Yeah, we used to call them earlier as non-invasive brain stimulation. Now it's been given another term, neuromodulation. And yeah, for a long time, ECT was the neuromodulatory procedure or neurostimulation, which is very well known. Um, the fact also is true that today not many psychiatrists are practicing vis-a-vis earlier days. My guess is earlier days most psychiatrists were trained in mental hospitals or perhaps were working in mental hospitals where ECT practice was quite prevalent. General hospital psychiatry, the most serious cases don't necessarily get admitted to general hospital. And for some reason or other, it might have not been possible to identify the right patient to ECT. And general hospital training and general hospital practice has somehow kept ECT on a lower priority. But I'm sure some of the good hospitals, some of the good medical colleges are still continuing to train students with the ECT. ECT practice is there. Of course, many of the AIMS, I know JSS and a few other good hospitals are doing it. There's no question. But the newer treatment models, starting from the transcranial magnetic stimulation, you have AC, DC, focus, deep stimulation. There's so many things which have come in the that current stimulation. Once upon a time, of course, the behavior therapists use it as brain polarizer, the same DC current, same small dose electrical application was being used in some format, essentially to help people to sleep, reduce their depression, reduce their anxiety. But I used to see in the behavior therapy department of NIMHANS and during my student days, a brain polarizer was being used. But I guess it has taken a new avatar and has come as the direct current, transcranial direct current stimulation. Now, of course, you have the transauricular stimulation. Then you have, of course, transcranial magnetic stimulation, repetitive magnetic stimulation, and so on and so forth. So it's a wide range of procedures have come. Of course, invasive brain stimulations, modulators, including DBS, which have come into place, and also the vagal nerve stimulation. So it's a wide range of things that have come forward. I believe more recently, a focused ultrasound is another method that has come as a treatment in some of the focal brain disorders, largely used by neurosurgeons and anesthesiologists. But I believe psychiatrists also going to lay hands on that uh, focused ultrasound therapy. So we have a opportunity to learn many of these procedures. If you ask me personal opinion, has there been a definitive role for these things in general psychiatric practice? I would probably raise my eyebrows and say that it's probably doubtful. And I'm not sure if there are any treatments available have been beaten by these treatment methods. Uh, Perhaps in a small way, yes, but not in a very large effect size data not being available. Okay, is it better than ECT, for example? ECT is being regularly used or other brain disease, or any of these things are better than we expect patients to choose a menu option of various therapies, and they would generally ask for non-drug therapies, therapies which are mild and so on and so forth. And that's how I keep seeing a lot of people ask for non-drug therapies. Do you have yoga? Do you have CBT? Do you have some therapies that you're going to offer rather than giving medicines? This seems to be a more trend that has happened. In that background, I think our psychiatrists should be aware of these brain stimulatory or brain modulation techniques, which have, of course, helpful in a good range of conditions, like I said, but not necessarily as definitive as the reason that the patients are demanding. We should also become alert and experiment and look into this. Yeah, treatment guidelines have been including some of these treatments, particularly TMS as a treatment, which is of course recommended in some of the treatment guidelines. I'm sure over course of time, with good experience, these things will emerge as treatment guideline operations in Indian guidelines as well. So I think it's the right time. Dr. Kishore has chosen this topic. Thank you, madam. I wish you all the best. Good evening and a nice weekend. So you are here. Wish the IToP team the very best and wish all the delegates a good learning experience of knowing what and how to teach treatment, how to teach our students with respect to neuromodulation techniques. And if they don't have it, at least refer the students for maybe a short 1 week or even a 1 weekend trial. And centers which have been practicing treatment of this nature should expose students by a 1.5 day workshop, inviting maybe 5, 10, 15 students who do not have this access to learn these procedures. These things can happen. I'm sure the entire effort of ITops, this episode would be very successful. Wish you all the best, and thank you for letting me come in and inaugurate this event. Thank you, Kishore. Thank you, madam. Thank you, TSS. Good luck for all of you. Thank you very much.
Thank you. Thank you.
Thank you, sir.
Thank you, Dr. Gangadhar. Good evening.
Madam,
Very
you
good
should take
evening.
the credit as the IPS boss that I don't think any other professional body is doing this sort of an exercise, to my
Yes.
knowledge. Having seen it from the NMC, I could probably well say that I'm not aware of any professional body doing this. Our own, encouragement and empowerment of our teachers with better skills.
Yes.
And I think you deserve this. Congratulations. And I'm sure TSS Rao will make it even more vibrant in the days to come. Thank you so much.
Thank you. Thank you.
Uh, Thank you so much, sir, for blessing this event and providing your experiential account. It is quite evident that, sir, you must have seen neuromodulation being developed, like you told earlier, it was a different term. And from the core neuromodulatory techniques like ECT and DBS, we have evolved over time. The technological shift, which included RTMS and the recent techniques with the institutional growth in India, like premium institutes like AIMS and NIMHANS, who have been a pioneer in development of neuromodulation techniques. The collaborative research under the guidance of our seniors and IPS in itself is a great thing which should be congratulated. Recently, we have also developed the National Neuromodulational Society, which has more than 70-80 members. And the national integration through it is something which could be applauded about. So we are quite um, zestful regarding the state of neuromodulation in India. I welcome Dr. Savita Malhotra, ma'am. Welcome, ma'am.
Thank
Uh,
you.
yes, ma'am. So I would like ma'am to provide us with some words of wisdom on the context of neuromodulation. Ma'am is the current president of Indian Psychiatric Society, senior psychiatrist, as well as the leader of uh, all psychiatrists today who want to work in the field of neuromodulation. Over to you, ma'am.
Thank you very much. Good evening, everyone. Sorry for me joining a little late. I start with my best wishes and congratulations to Dr. Kishor Rao, Dr. Snehil Gupta, and the entire team of ITops for continuing with the exercise and activity of training the teachers of psychiatry, and in various areas, especially where there is so much little already known or so much little that is happening. For example, psychotherapy and now neuromodulation. Neuromodulation, we all know, is a new treatment method that has come in psychiatry after pharmacotherapy and psychotherapies. This is a very major advancement or addition in our treatment methods. ECT, of course, was already well known, but other variations and methods of treatment of neuromodulation, RTMS, deep brain stimulation, and vagal nerve, and so many more alterations. So this is very, very important, and this is a new addition to treatment method in psychiatry. And but see, problem is that very few centers have the facilities for this, because the equipment and the machines are expensive, and we still are working on, we do not have very adequate a training or even approaches in conducting these treatment interventions, or also the analyzing. And so this is still a treatment in evolution, is getting more and more research is being done to see how best to get the results, and what are the uh, best indications where it is useful. So it is a very, very active field of research, and very few places have the treatment facility available. So it is extremely important that our young faculty and students where for learning, they need to really have good opportunity or maybe placement in certain centers to learn this. Again, as Dr. Gangadhar said, that congratulations to Dr. Kishor Rao and also to the entire team for carrying out these educational and training activities under the aegis of IPS. We did start the year with this request that we should have training in areas which where the training is very little or much less so far. And I must say that Dr. Kishore has done a commendable job in all these things. So I wish you all the best. I wish you, great success in carrying out in this activity. And thank you very much for inviting me over to this session of yours. Thank you.
Thank you so much, ma'am, for your motivating words and for being a beacon of all research and development pertaining to psychiatry as the president. Now, I would request Dr. TSS Rao, sir, to please share a few words with us regarding the neuromodulation scenario and his own experiential account. Thank you, sir.
Good evening, all, and my pranams to Dr. Abhiyan Gangadhar, Madam, and all the stalwarts who are there, and all the friends. One or two small points. Of course, Kishore, next room, I have him, and his mind works quite extraordinarily. Every alternate day, every third day, he's coming out with one program or other, and I must really appreciate his leadership for involving all the people and keeping himself academically in the forefront. That is one. The second one is IToP is doing a great job. In fact, for any association to develop in such an organized way and making a mark is something unusual, and I must really congratulate him, just like Dr. Gangadhar and Dr. Savita Malhotra mentioned. The third point, of course, neuromodulation. I still remember we were having this depression brain bank 3 decades ago. We were doing a little bit of work on hippocampus. That time we were talking about amygdala and its role. If I remember very clearly, when we were reviewing this word neuromodulation, there were hardly about 3 to 5 articles we could place on at that particular time, even at the international level. And if you go back a little earlier, say, for example, even learning, SR to SOR, that O, organism in general, one may be talking about, ultimately it may be the neuromodulation issue only. As Dr. Gangadhar was mentioning, something endogenously happening, and what can be organized in a proper way, properly it could be used as a treatment, and how it can be benefit to the clients who are having problem. This is a progress, and it is something extraordinary. Now, neuromodulation is one of the most used currency terminology in our practice. Almost many of the patients also, they come and ask, do you have this RTMS? That means already the things are moving in a little different direction. And I'm sure more and more proper guidelines, proper indications, and actually how the procedure can be actually done is an area which need to be attended in a very significant way, mainly because already maybe even about 2 or 3 years ago, how many centers had this facilities? Almost about 10-20% range, I think the issues are increased. We should talk always about ECT, and our department now has got the neuromodulation. And in the same fashion, whenever many colleagues, precisely what is actually happening is actually everybody is at this particular point. The only caution is whether these are going to replace our psychotherapeutic, other behavioral, other technologies, because everybody thinks that this one actually takes care of everything, means actually we will be lining up in a totally different area. So keeping oneself aware of where its utilization to the best extent possible. And everybody is in fact comfortable with this, not because of anything, but there were few procedures which carried the negative connotation. This has helped us overcome those things. So bright future awaits us actually some of the treatments are concerned. All the best, and these are all good learning experiences, and I'm sure in the coming days it will be in forefront as a therapeutic technique. Thank you so much.
Thank you, sir, for letting us being aware that what needs to be the framework and the legalities regarding neuromodulation. And as the president-elect, we hope that you are going to spread more and more, try and reduce the treatment gap pertaining to neuromodulation in most of the institutes. So thank you so much, sir, for your
Positive, sure. Done.
thank you, sir, for your positive comments. Now I request Dr. M. Kishor, sir, the chairman for the PG subcommittee of IPS, to please share his view on the neuromodulation. Thank you, sir.
Good evening, everyone. With due respects to the chair, Dr. B.N. Gangadhar, Padma Shri Awardee, and the former chairperson of the National Medical Commission, his presence is immensely important because when it comes to neuromodulation and before that ECT, he did some landmark initiatives. And I believe he was also the editor for the International Journal on ECT, and he has done some patenting work also for the instrument. So you have a person of that caliber who is giving direction. So his presence is immensely important. I'm really thankful to the IPS President Dr. Savita Malhotra, who has extended support to our committee and that of UG committee, and really thankful to the President-elect Dr. TSS Rao for making sure that all the programs are continued. We are really thankful. On behalf of the IPS PG committee, one of our major areas is to how do we support psychiatry faculty across 780 medical colleges where there are less resources. In those centers who are doing excellent work, how do we bring them on board? That were the two important goals. For neuromodulation, we thought of having one committee, and we took input from Dr. Shobit Garg, Dr. Sai Krishna Tika, and Dr. Sriraj. We requested them to contribute what is that we should do, and they gave a very nice input. But we need to listen to some of the people across India who are doing some commendable works, some great institutions, some great collaborators who are brought in many aspects for our understanding. So with IPS, UG and PG committee and IToP, we thought of requesting all the people to come board. So we have Dr. Nishant Goel, Dr. Nandakumar, Dr. Shubh Mohan, we have Dr. Urvansh, Dr. Ashok, and Dr. Sujit Kar, and so many of them have come today to give an insight into where we should take care of neuromodulation services and how do we help that imbibed in the Indian medical institution, both for undergraduate and postgraduate training. So on behalf of all my committee members, I'm really thankful to one and all. We are keen to listen to you, and we want to spread this message that wherever the psychiatry teachers are there in India, we want to strengthen them with available resources and available knowledge which can be shared among the psychiatry teachers. And as Gangadhar sir said, wherever there is deficits in providing neuromodulation, the nearest institution can take up the responsibility to learn that skill. That's very important in a sourceless center. So we should make sure that the psychiatry teachers empower the upcoming doctors, and this is a step closer. I'm really thankful to Dr. Varchasvi Mudgal, IToP's awardee, who took it up that he will collaborate and bring this work and team together. Thank you so much, Varchasvi. Over to you.
Thank you, sir. Uh, Before we begin with our speakers, I would again like to thank all of our chief guests and guest of honor for providing us with their valuable insights. Do we have Dr. Priyaranjan Avinash sir with us? So before we begin with our speakers, if he is here, as I'm not able to see his name in the participants, sir, if you could be kind enough to
Dr.
unmute yourself.
Kiran is there on
Yeah.
behalf of UG committee.
All right, sir. So I request Dr. Kiran sir, Professor of Psychiatry, to please share his words of wisdom regarding neuromodulation with us. Thank you, sir.
Thank you everybody. It's a great honor to share this unique platform with Dr. BNG sir, Madam Savita madam, and Dr. TSS Rao. I'm representing both IToP and IPS UG subcommittee, and we know that capacity building has always been a core aspect of IToPs. And the canvas with respect to neuromodulation is quite huge. To start off from where Dr. BNG sir was telling about ECT, recently a company in Bangalore has come up with a proposal for ECTs going to household. They have a machine that they will carry to the houses of the patient and probably deliver it at their footsteps, doorstep. So that's what has been contemplated. So I think this we are in a paradigm shift in psychiatry where things are coming to your house like any other modality. And probably as a chairperson of UG subcommittee, we need to expose our undergraduates in all the 780 medical colleges to these state-of-art facilities that is available in psychiatry, so that the stigma regarding a lot of these procedures are taken away. And since the canvas is so huge and there are a lot of differences between institute, it's time that we all share a common platform so that we have some consensus on what is neuromodulation and what needs to be taught. So that's where we stand today, and this is an unique opportunity. So thank you all for giving this wonderful opportunity for the UG subcommittee, and the ITops is looking forward for this collaboration. Thank you.
Thank you, sir. So before we move on to our guest speakers, I would like to thank and we are all deeply grateful to our chief guest, Padma Shri Awardee and former chairman of the NMC, Dr. B.N. Gangadhar sir, for his visionary presence and constantly championing the cause of standardized medical education in India. Along with this, I would like to thank Dr. Savita Malhotra ma'am, President of IPS, for her unwavering support in modernizing psychiatric practice and for her leadership in this consensus initiative. I would like to thank our President-elect, Dr. Of IPS, Dr. TSS Rao sir, for his dedicated efforts in bridging the gap between clinical practice and educational excellence in context of neuromodulation. The organizing subcommittees, both the IPS UG and PG subcommittee, along with IToPs, for their tireless efforts in bringing this unique program to fruition. And without further ado, now I would like to welcome all our guest speakers. Since I'm not able to see all the participants' names correctly, I would just like to ensure whether all the participants and the guest speakers are here with us. If they would be kind enough to unmute themselves and just acknowledge their presence. I would request Dr. Nand, I welcome Dr. Nand Kumar sir. Is he here with us? Dr. Nishant Goyal, sir, I can see he's with us. Sir, could you? Okay, thank you so much, sir. Dr. Urvaksh Mehta, sir. Sir, could you please unmute and just
Hi.
say
Hello.
hi? Thank
Good
you,
evening,
sir.
everyone.
Yeah,
Thanks for having me. Yeah.
yeah. Dr. Shubh Mohan, sir, from PGI Chandigarh. Dr. Sujit Sarkel, sir. Sujit, sir, I think you are here. Sujit Kumar Kar, sir, from KGMU. And Dr. Kishor from KMC Manipal.
Yeah.
Okay.
Good evening.
Yeah. Good evening, sir. So I thank you all for gracing this occasion and being a part of this consensus on neuromodulation training in India. Now I would like to request our first guest speaker, Dr. Nishant Goyal, sir, to please share his words of wisdom regarding the consensus and his experiential accounts, his training practices, and the state of neuromodulation in his own institute. Sir has been huge pioneer and leading force in CIP along with the whole region where he practices regarding the neuromodulation training. He is currently a professor at CIP Ranchi. He has numerous publications and is a leading authority on neuromodulation. I welcome you, sir.
Thank you, Dr. Varchasvi, and good evening to everyone. And a big thanks to the UG and PG subcommittee of IPS for calling me over here in this August gathering. Talking about non-invasive neuromodulation, I'll focus only on non-invasive neuromodulation. Don't not talk about ECT per se. So, non-invasive neuromodulation, it has been a journey for us at CIP, where we started it in the year 2002. And it's been 23 long years where we have seen the journey of development of non-invasive neuromodulation from humble RTMS to deep TMS. And it has been a very fulfilling and a very enriching journey where we have learned a lot of things over a period of time, catching hold of the developments which are very fast paced happening in the field of non-invasive neuromodulation, like RTMS gradually evolving to theta burst stimulation, gradually evolving to localization techniques, neuronavigation, robotic functioning, then TDCS, development in TDCS, talking about high definition TDCS. Now we are talking about accelerated stimulation. Then, and I must tell you that the field is growing almost every day. Every day we are getting something new which are in the pursuit of helping our patients who are suffering from resistant symptoms across various psychiatric disorders. Now, when it comes to the training part, particularly in this particular field, there are two aspects of it. First aspect is whether the training is required at the undergraduate level, or and it is required at the postgraduate level. So when it comes to undergraduate level, definitely, as we are still struggling with psychiatrists are struggling with a with a place for a place in undergraduate training. So when we talk about ECT, why don't we add, maybe a chapter or two, or some sort of a hands-on training for the interested undergraduate people who are interested in psychiatry overall, and not only psychiatry in terms of cognitive neurosciences. But when it comes to postgraduate training, people who actually choose psychiatry as their, lifetime things. So I think it should be an imperative part of training. It should be an imperative part of management. It should be there in, I think each and every institute should have it, and they should have a dedicated time, energy, and people who are interested and who are ready to impart training to postgraduate training in the field of non-invasive neuromodulation, which brings to a very important point that we should yearn towards having a curriculum. I'm talking about curriculum in non-invasive neuromodulation, a curriculum which is same for across various institutions or across various places in the country. So having neuromodulation in even district hospital, like I think Dr. Urvaksh is there. We have been having a project funded by India Alliance, which is due to finish next year, where the idea of that, we were given that project by India Alliance with the idea that we should bring neuromodulation to the bedside. And as Dr. Kiran was talking about, ECT now taken to homes. So the idea is to have neuromodulation facilities even in district hospitals, and things are happening. Definitely, things are changing. Things are happening over a period of time. So having the facilities, developing common curriculums which are used and utilized across the country, and definitely developing a pool of research, our own indigenous research, based, like focusing on what is happening in US or Europe, or nowadays, in Oriental countries like China and Korea. Why don't we have our own data? People are actually coming to India to find data. So why don't we have our own data? We publish our own data and have our own guidelines. We do have IPS guidelines or CPG for neuromodulation, but at the same time, that should be based on the research which is done in our country. So this is these are some thoughts from my side, which I wanted to share with all of you. Over to you, Dr. Varchasvi. Thank you once again for having me in this
Uh,
August gathering. Thank you.
Thank you, sir. Sir, just one more thing, sir. Thank you for providing us with this account of yours regarding the neuromodulation state. Sir, since you have been practicing as a faculty and teaching at a very premium institute of India, Central Institute of Psychiatry, so what would be the state of neuromodulation in your institute, as it primarily has postgraduates, not undergraduates, which you also try to emphasize on. So could you please share a few words regarding the state of neuromodulation in your institution?
See, we have been using neuromodulation primarily for clinical research till date. I must admit that clinical application is still lagging when it comes to using it for clinical purpose on a day-to-day basis. But over a period of time, people are now, having this particular thing that we should try in some of other cases, and that is how people are sending patients, more than that. But of late, I must tell you that the last 7 or 8 years, more than 100 MD theses and dissertations have been done on various aspects of non-invasive neuromodulation, starting from TMS to TDCS, now, deep TMS as well. Over to you.
Okay, thank you, sir, for providing us with the insights from your institution as well. It is quite a delight to always have you with us, sir.
Thank you.
Now, I would request our second guest speaker. Our next speaker would be Professor Dr. Urvaksh Mehta, sir. He is a professor of psychiatry at NIMHANS. He has more than 120 peer-reviewed articles spanning over the last decade, and definitely his research has a huge bulk on neuromodulation as well. So, sir, I would like to get some insights regarding the practices and state of training and neuromodulation at your institution, sir. Thank you.
Thank you, Dr. Varchasvi, and very good evening to all present today. And thank you for having me speak about neuromodulation training at NIMHANS. To start with, I'll jump right into the crux of the situation. As many of the earlier speakers have pointed out, there is tremendous growth of neuromodulation, especially in the last decade, internationally, worldwide, and more so in India in the last 5 or 6 years, especially post-COVID. There is a simple statistic is if you look at the vendors who sell neuromodulation devices and look at their sales across the country, you can see the difference. It has not increased, it has not doubled, it has gone up almost tenfold. So a lot of psychiatrists in India are using neuromodulation techniques beyond ECT. That how the large country that we are, it is still not sufficient. Many medical colleges still have challenges in training their students with the appropriate training required for neuromodulation therapy. So that brings us to the question: what is the need for neuromodulation, or what is needed for neuromodulation training? And there are four important ingredients. The first and foremost is the infrastructure. So all these neuromodulation techniques depend heavily on technology and infrastructure, which can be expensive, and that requires some support from the institute administrations to be able to acquire the infrastructure. Then, secondly, there should be a clinical demand, and there is a consensus with growing awareness and evidence base that there is increasing clinical demand. The third is we need to have clinical expertise. For example, at NIMHANS, we are almost a team of almost 10 faculty in the Department of Psychiatry who have who contribute to the neuromodulation program. And there is the fourth ingredient is that there should be a very strongly founded clinical and administrative collaboration. So it is not just the psychiatrist, but how we collaborate with our hospital administration, the paraclinical staff, the department of anesthesia, neurosurgery, and so on. So I'm talking from a perspective of neuromodulation, which includes both invasive and non-invasive techniques. The second component, other than what is, so now we know that these are the ingredients that we need for good training. The second component is the training structure. And again, I will allude, I wouldn't have much experience about undergraduate training, but it would be fascinating to expose undergraduate students to the concepts of neuromodulation therapy, especially how neuromodulation can be used as a neuroscience informed treatment, and the potential that it holds for understanding the brain, for correcting brain aberrations and mental burdens. So it's a good idea to introduce undergraduates to this concept. There's no doubt about that. The training structure at NIMHANS, especially in the last year, is that we have about 40 residents. A majority of them are spread across 6 clinical units. We have 1 day a week, which is dedicated to neuromodulation, and we have 2 teams, each team comprising of 1 senior resident and 2 junior residents, or sometimes 3 junior residents, who work in 2 streams of neuromodulation. One stream is ECT and ketamine, and the second stream is TMS and related TES, TDCS, TSCS, and so on. We do roughly between 35 to 45 ECTs in a day, and about 10 to 20 TMS per day, and about 5 to 7 TDCS sessions per day. So roughly that amounts to an experience of about once in 3 weeks, the junior resident or the PG trainee gets exposure to ECT and related neuromodulation services. The learning there is the content of the learning is supervised learning with the neuromodulation postdoctoral fellow and the neuromodulation faculty. So the students get to first observe and then very soon start hands-on administration. So you get to learn the skills very soon. There is also focus on didactics, but it is at a unit and department level. So that happens as and how the didactics are scheduled. The other part of the content is that it is a primarily case-based learning for the resident to understand and acquire knowledge and skills about clinical decision making. There are referrals from all kinds of neuropsychiatric conditions. So what makes us decide that we should give ECT or ketamine or TMS? What type of stimulatory protocol in TMS or TDCS should we go with? What clinical aspects would help us make these clinical decisions about what kind of therapy? So it is the decision making that is emphasized. There is also an element of critical thinking and evidence-based focus, not being too overly optimistic. At the same time, following what is evidence-based, and at times we do get referrals for some experimental treatments as well, when many other options are exhausted. The residents get experience in stimulation setting, the therapy administration, the use of advanced techniques like neuronavigation, where a person's own MRI scan is used to then locate exactly and precisely where the target of stimulation is. Dr. Nishant mentioned that the field has grown with different types of stimulation protocols. So earlier it was restricted. Now there is theta burst and various other forms of quadrupulse and other pattern stimulations, and then there is deep TMS. There is a whole range of skills to acquire. Clinical monitoring, safety, and efficacy, both in ECT and TMS and TDCS, is again taught. There are certain instruments that we have developed or we use from other centers, which help us assess both safety and efficacy. Decisions on session termination, maintenance approaches, follow-up assessments, and addressing difficult to treat clinical scenarios. So these are the basic content that goes into the training. There are no specific assessments for neuromodulation, but residents go through end of posting assessment. So they do get some theoretical understanding assessments on neuromodulation, and in the Viva and OSCEs, they do get some assessments on neuromodulation in their final exams. To end, I would also like to highlight the opportunities that NIMHANS offers. So we hold training workshops, which are hands-on training workshops, which start sometime in February and go every month, 4 such workshops every year. The target audience is anyone with a psychiatry training who wants to use it in a clinical scenario. And it is about 2.5 days and covers basic aspects of ECT, TMS, TDCS. We do a small sample in each workshop, 10 to 15 participants, maximum 20. And as I said, the demand is very high. As of now, we have a wait list of about 400 psychiatrists for the next session. So we'll be sending out emails to them for the next registrations. We also have observership programs. So if someone who is in an established institute who wants to come and train at NIMHANS can do a 2 to 4 week observership and learn specific aspects of neuromodulation. And then there are external PGs who are posted like they are posted to geriatry or child psychiatry, they are also posted to neuromodulation. So those are broadly the training options which are available. I will conclude now, Dr. Varchasvi. I hand it over to you. Thank you.
Thank you so much, sir. It was quite an illuminating perspective on the state of neuromodulation at your institution, sir, pertaining to the infrastructure, liaising with other departments, training structure, and the curriculum. Sir, you explained the PG training in neuromodulation in quite depth, giving us a insight towards adopting a universal structure of neuromodulation training pan-India. Thank you, sir, and thank you for also providing us with insight regarding the assessment, because at times we are not sure that as a PG trainee, what sort of assessment would be required for after getting a degree, or how adept are we at neuromodulation. So a certificate or OSCE, like you said, with a formal training with the vivas and OSCEs and didactic methods, may also require a further layer of addition to be more skillful at the neuromodulation training. Thank you, sir. Uh, Now we are delighted to be joined with by our next guest speaker, Dr. Nand Kumar, sir. He is professor in charge of ICMR care in neuromodulation for mental health, Department of Psychiatry, AIIMS, New Delhi. Thank you, sir, for joining us. I would like to get your insights regarding the neuromodulation state in at your institution. Over to you, sir.
Thank you so much, Dr. Varchasvi. Voice is simple.
Sir, just a suggestion. Sir, do you have any other ongoing Zoom, or are you on two platforms?
No, not only.
Okay.
I think you may have some speaker on or something. My speaker is rejoin.
Sir, if you permit, by the time you sort through this glitch, sir, can we have another speaker? Okay, thank you so much, sir. So moving on with our session, I think we'll just get back to Dr. Nand Kumar sir's insights in a short few minutes. By that time, I would like to request Dr. Sujit Kumar sir's Professor of Psychiatry at KGMC. Sir is a prominent figure in the field of neuromodulation, uh, and he specializes in the non-invasive brain stimulation techniques, especially for psychiatric conditions like OCD. He is actively researching and practicing neuromodulation. He also serves as the treasurer for the NSI, that is Neuromodulation Society of India. So thank you, sir, for joining us, and I request you to please illuminate us on the state of neuromodulation at your institution.
Thank you so much, Dr. Varchasvi. Am I audible to you?
Yes, sir, you are audible, sir.
Yeah. Rightly discussed that neuromodulation is an evolving field. Initially, focus was on electroconvulsive therapy, but subsequently, over past 2 decades, it is expanding rapidly. And rightly said by Dr. Urbach that post-COVID, the number of non-invasive brain stimulation related research is expanding like anything. To start with my personal experience, my institute is having electroconvulsive therapy from the very beginning, from the initiation of the department. My postgraduate training on neuromodulation was quite restricted to electroconvulsive therapy only. Subsequently, when I joined as a faculty member in the institute in 2013, in the same year, transcranial magnetic stimulation was brought to the department, but it was not used to that full extent. So we invited Professor Urbach Mehta as a guest speaker to the institute to conduct a workshop. And after his workshop, and we started using TMS in the institute. 2015, Indian Psychiatry Society has initiated a travel fellowship program. For the first time, I got the opportunity to get that fellowship program, and I collaborated with Dr. Urbaks, and Dr. B.N. Gangadhar was my mentor during that time. Dr. Jagdish Tithali, Dr. Urbaks Mehta, and Dr. B.N. Gangadhar. I got the opportunity to be at NIMHANS for 2 weeks for a focused training on particularly on TMS. Though I got a chance to see the way electroconvulsive therapy is being delivered there, and transcranial direct current stimulation was delivered there, but my focus was primarily on TMS, so that I can optimize the delivery of TMS facility in my institute. So that was a eye-opening experience for me. And after that, I wrote a joint article with our mentors, which was published in Indian Journal of Psychiatry during that time. That was just to popularize the travel fellowship program and whether it is actually helpful. So that was the first formal training process that I have undergone at NIMHANS Bangalore. After that, 2016-17, Dr. Nand Kumar and Dr. Rohit and a lot of Dr. Nissan, Dr. Subhan, Dr. Murlidharan. So we all initiated to found the Society, Neuromodulation Society of India. So from 2016 onwards, there was a regular workshop which is being held on the 3rd week of December at AIIMS Delhi. So that was continued for quite long time. So that was another opportunity to collaborate with people who are working on neuromodulation and to learn about the recent development progress in the field of neuromodulation. Though through all this process, it enhanced my skills and understanding about neuromodulation, and I tried to use it in my institute in a more number of patients and in a variety of psychiatric neurological conditions. In 2020, I was keen to initiate the TDCS service in my institute, but somehow, because we all know that there are a lot of procedural delays and financial constraints. So finally, we could not start TDCS in my institute. So I thought, because even I got exposed to TDCS therapy at NIMHANS Bangalore during my that travel fellowship time, but I could not brought it to my institute and use it for clinical or research purposes. So I thought that I should take a risk. So I purchased a TDCS machine in 2020 of my own, thinking that I will pursue a PhD in neuromodulation, but somehow it could not substantiate it. So I thought I should use that TDCS machine for the MD thesis program. So we started 3 MD theses using that TDCS machine. And in 2021, we had a new Vice Chancellor, Lieutenant Colonel Vipin Puri sir. He was kind enough. He had an interaction with the faculty members. He personally asked what are the things that you need to develop a particular facility in an institute. So he was happy that we are planning to establish a neuromodulation center in our institute. So he immediately granted financial support for procuring a better TDCS machine and a TMS machine. Previously, we are having a TMS machine which only deliver the conventional TMS treatment. He approved for a high-end machine which can deliver also theta burst stimulation and compatible with neuronavigation. So we got these 2 machines within a period of 1 year. It further expanded. We included more number of patients. The training of the students become much easier, and they show also more interest in neuromodulation training. Then last year we got approval for high definition TDCS, and luckily we thought of, because we have a good number of neuromodulation facilities in our institute, can we start with a one-year course of post-doctoral fellowship in neuromodulation? Before the COVID, there was a joint initiative by NIMHANS Bangalore, CIP Ranchi, and Manipal. They started a PhD program on neuromodulation. I had a discussion with Dr. Urbaks that I want to enroll for that course. I was quite interested during that time, but somehow I could not pursue that. That was the idea, that can we start a one-year neuromodulation course, because this one-year neuromodulation course was there at NIMHANS Bangalore, but it was not there in any other institutes. So we got the chance to start a one-year fellowship in neuromodulation in 2023. So 24 to 25, we have one candidate on postdoctoral fellowship on neuromodulation. So after that, we got a message that from NMC that all the certificate course that need to be reported to NMC, they will evaluate it further and they will give a final approval. So we provided all the details to NMC, but we have not heard anything. So unfortunately, from 2025, though we started in 2024 and 2025 onwards, there was no further candidate that has been recommended by NMC for the fellowship course. It is not only related to neuromodulation. All the departments, all the fellowships course are on hold. So this last 1 year, we don't have any fellowship course at KGM right now. So this is the roughly the journey of my journey in the field of neuromodulation. Regarding the teaching facilities that we provide at our institute for the undergraduate students, they have a clinical posting in the Department of Psychiatry when they are exposed to neuromodulation facilities, and they have a theory lecture where neuromodulation and other somatic treatments are taught to them. After the competency-based medical education came, we got an opportunity to start some electives on electives from the field of psychiatry. So we provided a framework for 2 weeks elective course on neuromodulation. Right now, 5 students, they opted for neuromodulation electives, and they are currently being undergoing from the 1st of January. They are in the department. So students are also taking, undergraduate students are also taking interest in neuromodulation and non-invasive brain stimulation. Regarding the postgraduate training, the postgraduate residents, they are regularly posted in the electroconvulsive therapy unit and TMS unit to deliver the therapies, and myself, and there is one more consultant who is dedicatedly looking after neuromodulation. So we have a discussion related to different protocols, and we when the new residents they join, we do a hands-on training of the residents on all the neuromodulation facilities that we have. After regular use of neuromodulation, the other departments from my institute, they are sending regular references for neuromodulation services. Like we get references from Department of Physical Medicine Rehabilitation for providing neuromodulation support to people who are particularly having cerebral palsy to release the motor spasticity. We get references from Department of Neurosurgery and Neurology for cases of refractory epilepsy. We provide TDCS bedside TDCS facilities also we provide. We also get reference from pediatric department and neurology department for rehabilitation of stroke rehabilitation, for the management of aphasia, for management of dystonia, and almost every day we are delivering around 5 to 10 sessions of TMS, around 3 to 5 sessions of TDCS, around 10 sessions of electroconvulsive therapy. So because it's a daily procedure, so all the residents, they get adequate exposure on neuromodulation. Regarding we want to, I see that having a course on dedicated course on neuromodulation, at least 1 year or 6 month certificate course on neuromodulation will be definitely useful for the psychiatrists to enhance their neuromodulation related skills. It is not easy to start a course. If at all you start a course, it is difficult to sustain it. So a lot of hurdles are there, but still, despite of all those challenges, I think we'll get a approval by NMC and we'll resume the course, and the facilities will continue to grow. Thank you.
Thank you so much, sir. Your insights regarding the infrastructure, the administrative hurdles, the state of undergraduate training. It was quite a novel initiative to think of neuromodulation training as a elective, because sir, in many parts or in many institutions, the electives are merely electives for name. Many students are mandatorily given some topic for their electives. So it's good to see that young undergraduates are opting for neuromodulation techniques, which will give them a sliver of sliver into the world of psychiatry. Also, sir, the training program regarding the postgraduates, as you being the you heading the unit along with other consultants, also gives us a structure. And lastly, the regarding the certificate courses and formal training, I think if that things gets through, it would be a boon for whole psychiatric fraternity. Thank you so much, sir. Now I request if Dr. Nankumar sir is ready for his insight, sir. Can we have you with us?
I'm ready. Am I audible now?
You are audible, but still the voice is echoing, I think. Sir, if possible, can you join through another device like a mobile or anything else? That would work as well, sir.
Let me try.
Okay, thank you, sir. I think we are also joined by Dr. Shubh Mohan, sir. Sir, can we have you on camera, please? Yes, sir. Thank you, sir. So by the time Nankumar sir gets his things in order, I request Dr. Shubh Mohan sir to please begin with this session. Sir is a faculty at PGIMER, Chandigarh. He has been a recipient of various numerous awards. His research interests and areas of work include non-invasive brain stimulation techniques, community psychiatry, and sir is also had numerous publications which have given us insights regarding the state of training and the future way forward in the field of neuromodulation. Thank you so much, sir. We are delighted to have you. Over to you, sir.
Yeah. Am I audible?
Yes, sir, you're audible.
Yeah. So, first of all, thank you very much for inviting me over here. I'd like to say it's a very nice initiative because we've had 4 speakers who have spoken about, their own points of view. We've had one from NIMHANS, one from CIP, then from KGMU. I'll speak from the perspective of a postgraduate training institute, PGI Chandigarh. We don't have undergraduates, but we are also a multi-speciality hospital. So we are a bit like AIIMS in that sense. So it's a different perspective. So we have around, at any given time, around 30, 35 MD people and around 8 to 10 senior residents. As far as neuromodulation goes, we've been doing this for the last, say, around 10 years or so, and it's basically a clinical service as of now, and it's run on referrals. We get referrals from different consultants whenever they feel that there's a patient that needs, some sort of neuromodulation. They refer a patient to us. We have also started to get patients from other departments, especially ENT for tinnitus, then for aphasia and pain and various other conditions. We've done a few theses, and also somebody from neurology is doing a PhD right now. So my experience is from the point of view of a clinician and from a clinical perspective. As of now, what we do is in our MD training, we have 1 month posting in community and neuromodulation. So all residents are supposed to rotate through the neuromodulation service, during which time they are expected to get some sort of experience in neuromodulation. What we've tried to do is basically that all residents who get through psychiatry should have some degree of understanding of the mechanics of neuromodulation, how to set up a treatment protocol, how to ensure safety, how to do a proper return informed consent, how to take an intake, how to assess patients on outcomes, etc., etc. So that is all the routine things that we keep on doing. So that is something that we have been involved in. So I would like to say that there is a lot of demand and a lot of interest in neuromodulation. That goes without saying. I have been part of some of the programs that Dr. Kumar runs every December in his department with regards to training for RTMS, and those programs always sort of highly sought after. So I would say that all over, even Urvaksh said that he has a long waiting list. So there are lots of people who are very, very interested. What I would think is that after 10 years of doing neuromodulation and having developed some sort of interest, I think that neuromodulation has a lot of future. It also requires a lot of understanding. It also requires a lot of pragmatism with regards to what it is and what it is not. I think when it started, people had very unreasonable expectations out of RTMS or TDCS. I think with time, what we are finding is that RTMS and TDCS is another modality of treatment with regards to psychiatric or neuropsychiatric disorders. And it is no replacement for ECT, for example, but it may be useful in certain conditions. So my final words are that, first of all, a lot depends on the kind of, the manpower that you have. It is obviously expensive. You need some devoted time. You need devoted space, which is often not possible for many people. But I think neuromodulation techniques have a lot of interest. There are lots of people in the private sector and also in other hospitals who are very, very interested. I think almost any department now can buy a TDCS device, if not an RTMS device, because you can get Indian devices for pretty cheap. I got one for my own use, which I have used because our machine was defunct for some time. So I bought one, which was quite cheap. Not a problem. Works as well as the other one. With regards to the curriculum, I think at a PG level, a basic curriculum is expected. And if you have seen the recent exam questions, I am an MD examiner in many, many places, and you'll find that every exam has one or two questions on neuromodulation nowadays, even though they would not have devices, for example. But so there is some degree of information and education which is going on. I think what is needed as a second step is that all psychiatry departments should have some device, at least a TDCS device, if not an RTMS device. And there should be some degree of, rotations for all residents where they can be, because being trained or having an observership is one thing, or even having a 1 or 2 day workshop is one thing, but nothing really replaces hands-on experience. And I think finally, what really matters is how familiar and how comfortable you are with a particular device. And that is something which is only possible if you really have a device that you can use anytime. With regards to the other stuff, because in our department we have patients who are attached to residents or residents who are attached to certain patients. So as a matter of fact, and if their consultant is interested enough, many residents have the opportunity of learning about certain, problem-based approaches to neuromodulation. And we have always stressed upon the fact that, neuromodulation should not be looked at a mechanistic diagnostic level. Rather, it should be more symptom and, clinical profile-based. So I think from all of those aspects, that is how we have had our journey over the last 10 years. At a more or less clinical level rather than at a research level. And I think there is still a huge scope and there is still a huge interest in neuromodulation. And it's only when we use it that we'll really know what it is all about and what it is capable of. So those would be my thoughts, initial thoughts about my experiences in neuromodulation.
Thank you so much, sir. Thank you for providing us with this enlightening perspective regarding the state of neuromodulation at PGI, Chandigarh. I think, sir, this perspective includes both as a faculty, as a clinician, and as an administrator, and which has given us various insights regarding the way ahead. Thank you, sir. Uh, before we
Am I
go,
audible?
yes, sir. Uh, yes, sir, you are audible, sir.
So
Nankumar, sir.
finally, I feel lucky. Thank you so much,
Yeah.
and
Yes, sir. Thank you.
sorry for the trouble.
No issues, sir.
Thank
Please.
you for inviting me, and thank you for the IPS also for taking this initiative. In fact, if you speak about neuromodulation, we are using neuromodulation techniques since 2009 in AIMS Delhi, and we started with TMS. At that time, TMS was not very popular, in fact. So we started with TMS in 2009. Then we expanded our services, and now we are using the TMS, deep TMS, and with various coils. And one of important thing that we have is across the country that we have various machines from various manufacturers. Like say, for example, MagVenture also, MaxTeam also, and we have navigation also that we are using. Uh, in addition to this techniques, what we're using, we also use the TDCS, and we're going to start soon the MST. It is in the process. So, neuromodulation techniques are genuinely important techniques. And what we see, what we perceive that all the techniques are neuromodulation techniques. You do psychotherapy, that's also neuromodulation. So we try to bring our focus on mechanical neuromodulation. And in all the department of the medical sciences, mechanical things are needed, in fact. So we should not shy away from that. It's mechanical neuromodulation. We should use that. Mostly in India, we are using it for research purpose, but we are also using it for clinical purposes with a weekly clinic on neuromodulation. So all the patients are being followed up with a research patient or patient for the clinical condition. We are inviting them in the clinic, and we are maintaining the data also for those patients. We have good collaborations with Department of Orthopedics for some projects, then IIT Delhi, then neurology and physiology. So we're using for both research and clinical use. Now, this is I think, the techniques that bring us very close to other departments, and it brings us very close to other medical specialty, and we are more, recognized, quote unquote, by the other people. Unless it was something like a talk therapy earlier. So the training is very, very important in neuromodulation, and we have been using the training workshop, hands-on training and CME since I think last 8 years. And it was yearly 2 years back. Now we are doing it periodically, and from this year, December onwards, we are doing it 3 times in a year. But training of neuromodulation is, I think it should be robust training. It's not that handling one machine. We should have the robust knowledge of the theoretical aspect also. So in our training program, what we are doing, we're inviting faculty. We have a group of faculty trainers from anatomy, physiology, neuroimaging, and neurology also, in addition to psychiatry, so that it can be robust training, and it can be intensive training with hands-on workshop. We are conducting it for 2.5 days with each training and workshop session. And of course, we charge, but it's nominal charge. And if we compare some of the training that what we provide, including NIMHANS, Bangalore also, what I'm aware of, in India, the training is not less than other countries. Because I had been to some other countries like Oxford in experimental psychology. Our training is much, much better. And in our batch, I think there is 1 or 2% from either US or Dubai or something like that. So training for neuromodulation is important for psychiatrists, PG level, UG level, I'm not very sure, but we are teaching. We are having some classes for UG for neuromodulation, but not hands-on training. For PG, we have a regular posting. One senior resident, one junior resident, they get posted in our neuromodulation facility. And the clinic also, this is rotation basis. It's a 1 month posting, in fact. So just to conclude, no, I think neuromodulation training is important, but at tertiary care level, because no, then it will be too common and perhaps not well utilized. And then still we are seeing that no, neuromodulation is a pill for all ill. So we have to be careful for that also. So it should be robust training for the PG level and for research purpose also. And I think IPS can develop some some sort of guidelines for the adequate training and what training should include. That also will enhance our presence in the area of neuromodulation globally. Thank you so much.
Thank you so much, sir. It's good to have insights from the Apex Institute of India regarding the state of neuromodulation. Uh, Sir, I think you shed an light on an important aspect regarding the current state of neuromodulation in India versus the Western world and the foreign nations. And it is good to hear that we are in a good state and are always striving to be better than the day we were yesterday. Thank you so much, sir. Now coming on to our next guest speaker, Dr. Ashok J. He's a assistant professor at KMC Manipal. He holds the responsibilities of postgraduate training and undergraduate training along with clinical research and is also the in charge of neuromodulation services. Over to you, Dr. Ashok.
Yeah, good evening, everyone. Thank you for this opportunity. So, as Dr. Urvax and Dr. Nishant were mentioning that we had collaboration with them, and I was one of the first fellows to join a 3-year fellowship in neuromodulation, but basically it was clinical research. So I did my post-graduation in KMC Manipal, and then I joined this fellowship here. So that's when I noticed that the postgraduate training in especially ECT or TDCS or other things was a bit fragmented when I was getting trained. So like we were posted like once in 2 weeks or once in 3 weeks, and you see the patient today, and by the next time you go to the ECT suite again, that patient would have finished their course and gone or something like that. So we were able to just see fractured or fragmented courses of the treatment. So we would not really know whether the person was improving with that or I mean, in person. We would see them in the ward, our own patients, but that was it. So when I started working in neuromodulation, so I used to be there every day for all the patients for every sessions. So that's when I realized that it was important to see the patient from beginning to finish for us to know how this process actually works and how long the patient takes to recover or so and so. Then I suggested Dr. Samir, my guide and my HOU at that time, that it would be nice if residents have a complete 1 month posting in neuromodulation instead of having been posted once a week or once in 3 weeks like that. That's when Sir started this 1 month rotation. We started this in around 2023 mid, and now we had around 32 residents going through entire month of neuromodulation. So in the morning we have ECTs, and then we start with TMS and TDCS, and then if they have any ketamine, they'll go with that. So that way they get to see the patient from intake to discharge, see what are the different aspects that can go wrong during the stimulation process, how to do the intake, and also see what are the possible factors that could make them respond to the treatment or not so much. That's when our residents also started getting more how to say confidence in administering these treatments. That's what the feedback we got from them. So since all the colleges do not have these facilities, some colleges from Bangalore or our own sister college from KMC Bangalore, they send their residents to our center for a week or so to observe, but they don't get to have hands-on because it's a very short duration. So this way, I think, and we also, since we have undergraduate course, every resident that is posted in psychiatry for about 15 days, as part of the CBME curriculum, all of them are mandated to observe ECT. That's when we get the MBBS interns to come for the ECT procedure. And because I oversee the ECT and TMS here most of the time, almost every day, the residents and also the interns, I have a one-to-one discussion with them on all these procedures. Then if I see any intern that are keen and enthusiastic about neuromodulation or psychiatry, I would suggest them that they can come and see the other procedures of TMS and TDCS also. Not all of them are very keen. Most of them just want to finish the mandatory ECT observation and run away from there. But there are some that we have identified that are very keen to know how this works. And besides this treatment process, we since we are also involved in this clinical trials, we do this clinical research also. Our residents get to see the clinical research part of it also because they are there the whole month with us. How to do various TMS markers and all. I think that instigates some kind of keenness to clinical research in the residents. This has been my experience here. I think having a 1 month continuous rotation for postgraduates would make a difference in their understanding instead of fractured postings or once in 2 weeks or something like that. Thank you.
Thank you so much, Dr. Ashok. It was quite a journey which you have had, being a resident, then entering into the fellowship, and now sharing your knowledge and skills with the upcoming generation of trainees. Thank you. So before we conclude our session, I think we have a few participants along with us who have specifically taken time to be a part of this consensus. I request if anybody in the participants panel would like to share their comments.
I think Rachna George, if she's there, she can say something from the CMC. Dr. Rachna George, are you there?
Yes, sir.
Would you like to say something what you have been doing at the CMC?
Yes. Thank you, sir. I just joined out of curiosity. It's not that we were doing any structured sort of training here in CMC, but like the others have put in, our postgraduates do have their clinical postings. We have ECTs running here twice a week. So they are posted in the ECT suite. And so that's the regular training that we have here. As for the undergraduates, I think one experience that I've had with them is they do come in for their usual rotations in the third year. So I think that's a very good opportunity to capture on their inquisitiveness and their curiosity. So we do take them to the ECT suite when there's an ECT going on, and some of them do get back to us with an interest of writing up a case report or doing a bit of hands-on research with the institutional funding. So I think in terms of undergraduate training, I think we have had some good experiences with the undergraduates. But I was just listening to the faculty from many of the eminent institutes speaking, and I really admire some of the work they are doing there. So I think maybe I can get back to our teams here and maybe organize it in a more structured way. And it was really good hearing the inputs from our institute. Thank you.
Yeah, I just want to add the undergraduates also have something called undergraduate conferences in most of the institution. Like
Yes.
in cases, we have the upcoming undergraduate conference. And what is very fascinating is that they can choose workshops. There are multiple departments which put up the workshop and people have to register. So for the January cycle, when we put up a workshop on neuromodulation from the Department of Psychiatry, JSS Medical College, we were surprised 15 slots were sold out in a day. So they made another slot. So again, the second 15 slot were sold out. So they made third 15 slot, 15 people slot. So we have 45 people who have paid around 2,000 rupees to have 3 hours exposure to neuromodulation. So we were also surprised how the undergraduates think and work. And they also came up with research idea. They wanted to capture narratives of the patients who undergo neuromodulation, especially RTMS. So they wanted to see what is the patient experience from ECT and what is the patient experience from the RTMS. So if you allow the young minds to come to the psychiatry department, I think they will show us the way where they can take us forward. The second is that in the external postings of psychiatry postgraduate, we have customized in the sense they can choose one postings which they want among many things we offer. So at the JSS, we were also surprised when this postgraduate picked up 1 month for neuromodulation. So it is another opportunity. If you don't have the facility, you can recommend. So we allowed this postgraduate to have 1 month of postings in neuromodulation at NIMHANS. We just started neuromodulation at JSS. So I think it's a very innovative concept. If you allow postgraduates for, as Dr. Ashok was saying, why not allow them for 1 month continuous postings if you have an option in the external postings, instead of their time getting divided into many other, we can customize that. That is feasible, and I think we should allow many institutions wherever the facilities is there, or the neighboring institution, if it is having such facility, we can allow them. And the other thing I wanted to say is that when we started the neuromodulation RTMS at JSS, all our students were collaborating with Mandya Medical College, which is a government medical college. Those students came to JSS and they learned one thing. We were happy to allow them to take up the facility. So that's another way. If you don't have, please collaborate with your neighboring thing. And psychiatry teachers everywhere have the very good heart to allow other students also to learn in their centers. So I think it's a positive step for psychiatry departments to allow other institutions also to come forward and utilize the facility. These are some of the opinions I have. Over to you, Varchasvi. Thank you so much.
Thank you so much, sir. Do we have any other participants who would like to share their inputs? Okay, so before we conclude this session, I would like to share a few takeaways of this consensus. First being the unified standards that this session successfully brought together the IPS UG PG subcommittees to lay down a groundwork for the standardized national curriculum and the way ahead for neuromodulation training. The institutional synergy being the insights coming from the insights from the premium institutes like AIMS, NIMHANS, CIP, PGIMER, and many other apex institutes, which have helped define the core competencies required for the next generation of psychiatrists. There is also the consensus also focused on the shift to interventional psychiatry, that other than being only a research-oriented technique, neuromodulation should also focus on the interventional aspect of psychiatry. That is, the transition of neuromodulation from an alternative therapy to a primary evidence-based intervention in Indian clinical practice. So, for the closing remarks, I would like to say that we have moved significantly closer to a national framework which ensures every psychiatric postgraduate, undergraduate, and any person related to the field of psychiatry receives high quality standardized training in neuromodulation. We extend our deepest gratitude to our chief guest, Dr. B. N. Gangadhar sir, and the IPS leadership for their vision, including Dr. Savita Malhotra ma'am and Dr. T.S.S. Rao sir, to the IPS UG and PG subcommittee for sparing their valuable time and helping us organize this valuable consensus session. Last but not the least, to our speakers, Dr. Kumar sir, Urvaksh Mehta sir, Nishant Goyal sir, Sujit Kar sir, Shubmohan sir, Dr. Ashok, and our dear delegates and participants who spared their time to be a part of this consensus. I believe that this consensus will not just be a document, it is a commitment to improve the patient outcomes across the country through through scientific excellence. I thank you all again. Sir, I think with this we can conclude our session.
You can say stop the recording.